I came down here with a friend and ended up not in that, so I just kind of went out on my own, and then I ended up homeless. I had about 5 years on the street. I got anxiety and depression, and you know, I struggled with substance abuse, and it just was a bad deal. It was the worst time I've ever spent.
So we know that there are some foundational supports that are really important. Things like somebody's housing status, things like somebody's wage. We know that families living in poverty have worse health outcomes. We know that homeless people living on the street tend to have a lot more health challenges. So we want to help stabilize and create these foundational supports around housing stability and also livable wages and work support.
We have heard from folks on the street, and even medical providers have always said, you know, if you really want people to be successful, you really need to put a roof over their head or help them.
I never did have a job right now on the street. Well, except I did work for a guy doing trees, but I missed a lot of days. It was very hard to make it to work, you know, without a stable place to be.
Folks that have stable housing and work rely less on our public assistance programs, institutional placements, emergency room use, unnecessary hospitalization. We know that they do much better by being in safe environments. With our foundational community supports, we can do case management and care coordination around the housing services, and same with employment. We do wonderful employment services and help people find jobs that really fit their skill set.
What we have found so far in supportive employment is that we're able to offer a more comprehensive service to our individuals. We work really close with some of the partners in our community, and we ourselves even had an opportunity to provide a work experience for some of those individuals. But what they didn't have was the ongoing case management as intensive as we can provide with supportive employment. And that is a huge difference with our folks that we're serving. With supportive housing is the same thing. Before, it might be that we saw somebody once a month, and now with this support services, we're able to invite them to come back to us as often as they need to.
I went out and I found a job, and then that was kind of it. You know, I just was going to work. I didn't have nobody coming to the job or anything like that. And then I went from case manager to employment specialist. And she is a godsend. She comes to the job and sees me. You know, she tries to come once a week unless she's got appointments, and she's been very, very helpful.
He had maintained employment for a little while, but once that case management was gone, Duff had fallen back into old behaviors and not really maintaining his employment. And so when I came as a support employment, I had the opportunity to use the FCS model and be able to provide more case management with Duff.
Employment is very important to me, and it makes you feel like a human being again, you know, part of society. It does, and it just means everything, you know.